Good afternoon, everybody. At 30, and we are at the City of Laredo Health Department Conference Room. I would like to go ahead and call this meeting to order, and also at this moment in time, we do not have a quorum, so anything that is said or shared is for informational purposes only. On public comments, citizens are required to notify members of their intent to comment prior to the start of a meeting. Comments are limited to 3 minutes per speaker. No more than 3 persons will be allowed to speak. Issue, they need to select not more than 3 representatives to speak for them, and the presiding officer may limit the public comments further in the interest of an orderly meeting. Speakers may not pass their minutes to any other speaker. Comments should be relevant to city business and delivered in a professional manner. Angie, do we have anyone that signed in for public comments?
No, no.
Thank you, Angie. We will move forward with committee membership. One of the things that we looked at and so we hope to be able to follow up on that for the next meeting and have an update. Questions or comments on that? The next item is future meeting minutes. Future meeting dates, I'm sorry. That the last Wednesday of every month at 5:30 would be the time that we would meet as the Suicide Prevention Committee. And that's just to let everyone know that was approved back in October, and it will continue unless the committee decides otherwise. So you can mark your calendar that rain or shine, we will have a meeting every last Wednesday of the month. The next item is discussion and possible action, and there will not be an action, only discussion and information. The City of Laredo Police Department report and statistics.
Good evening, everyone. I know what we usually do every time that we meet, we follow up on statistics from the last time that we met to present. So what you're gonna see is the last case of the year, which happened in late December. And then we're gonna talk about cases that we've been experiencing this month. Unfortunately, we had a very bad week. We saw 3 suicides.
I'm sorry, were they completed suicides?
Yes. And since Lieutenant Garcia has better eyesight than I do, he's going to take over the presentation.
So, good evening, everyone. Thank you for having me back to this committee meeting. Was temporarily or for a time assigned somewhere else due to thankfully a promotion, but I know that the mental health unit has followed me to where I'm at, and I'm grateful to be part of it. Adding to it, so hopefully maybe 1 or 2 more officers that will cover more of the shift work and the need for addressing any mental health related calls. So just as Chief Gonzalez was saying, we're going to go over a few of the statistics since December of 2023, updating everybody from last year until this. Compared to 122, you can see the service calls, you can see the reports taken. This is just dealing with suicides. This is just anything suicide related, attempted or otherwise, and any of the events resulting in death. As Chief said, not a good week this week for our community, but we are working on that. We are trying to continue to push out that message, the importance of disturbances, anything involving any clients in border regions and HMR, they are pushing out the resources. The resources, anytime that they may not feel that they don't want to talk to us directly, they see the uniform. We've actually had calls where they request a mental health officer, because our mental health officers are in plain clothes. They do have an identifier, they do have a badge, they do wear a gun, but they're so used to them because of the system that we have implemented here locally, that they feel comfortable talking to them, and sometimes they'll even request the caseworkers, but more often than not, the easy button, which is fine, we get called for everything, all sorts of cases, all sorts of events, police related or otherwise, but by all emergency detentions this year, we're at 42 compared to last year of 563. You'll see the suicide investigations. Anything in red is the result was a deceased person. Anything in the gray or white, those were the attempted. So we have, dating back from the 28th of December, we have the first one addressed here is a gunshot wound. Point out here, I know that Chief and I discussed this, but we don't have a map as far as hotspots. Hotspots we get to is just something, a term that we use for areas where the calls come in. This is spread out. We just want to, we always emphasize that, and we'd like to re-emphasize that everybody in our community is affected. It doesn't matter where you live, it doesn't matter what part of town, community, or otherwise, everybody's affected. We have the west side with 4400 San Agustin. That's 2800 East Locust. Same side of town, 3000 Guadalupe. We have the north side, Bob Bullock International. We have Aztec area, 700 San Leonardo. South side, 3300 Juan Novoa Drive. And 3900 Interstate Highway. This is just for this month alone. Going over these cases. Going back to the one on December, this was a self-inflicted gunshot wound. Male subject, 24 years of age, call for service was received that indicated a male was found. During the death investigation, LPD discovered that the male had contacted a sibling and commented that he was giving his family access to some monetary accounts and he planned to visit his deceased mother. $1,400 Bonaparte. We have a 29-year-old male by hanging. First responders arrived at the location to find a male subject unresponsive in the back. Used a cord and tied it tightly around his neck before being discovered, hanging from a structure. According to family members, the male had attempted to take his own life on other occasions. The 18th of January, 62-year-old male by hanging. Family reported to authorities that male was found to have taken his life by hanging. According to the family, the male had an extensive medical history and often spoke of how much pain he had to endure. Traffic accident that resulted in fatality. During the initial stages of the event, after the accident, a male lost his life due to a self-inflicted gunshot wound to his head. Both decedents were members of the National Guard. Again, we have that always usually provides a special type of level of communication. On the 30th, we had a 15-year-old female by hanging. Emergency personnel responded to a residence after a mother had reported to have found her daughter unresponsive. Evidence suggested that she had taken her own life through means of hanging. Female had received services CAPS at Border Region. Keep in mind, juveniles that go through the CAPS program, the parents always have the authority to refuse the services. Sadly, $3,900 US Highway 35 this morning. 60 after having fallen from an overpass structure along IH-35. Male subject succumbed to his injuries at a local hospital. During the investigation, it was learned that the male had received services at Border Region Imaging Margarita. So, this is why, I'm sure everybody's familiar with this, this is why we try to do as much follow-up as we can. Even in instances like this, people say, well, what can you do at that point? There's still families left. Detectives and police, and we retrieve our resources. We always need those resources, other resources, to try to guide the families in any way possible with coping. I know that they have a million things on their mind. They will have questions. They want to know why. They want to know what's next. They want to know. They have insurance questions. They have all sorts of questions. Provide anything that would cover or at least aid them and pointing them in the right direction, we welcome that too.
Excuse me. As you can see, last year we were close to the number that we were the year before that. I believe 2022 we had 18. Last year we saw a great success. They started climbing, so they went up to 17. This year, we hadn't seen a case until I believe the 12th. Different circumstances. Half of those cases, as you can see, they were being linked up to resources, or they were already at some point getting some if they can. Especially in those cases with juveniles. Parents have a lot of say-so in these cases, and we like to work with as much resources as possible. We encourage anybody that's working with juveniles resources as well. Put as much pressure on the parents to be responsible. I know that they don't do it because they don't want to be responsible. A lot of them think that they can help their children cope with whatever's happening. But at that point that they're already getting services, they need professional help. So we need to trigger as much as possible. I know a lot of it is ignorance, we know that. We don't know what resources are out there because probably the first time we've experienced something like this as parents. So encourage all of your programs to put out as much information, guide people, don't assume that they know. Put it out there as much as possible. Other than that, any questions on any of these cases?
Unexpected loss of life is very unfortunate for the families, the social circles around them, and 5 already this year is very concerning. I mean, at this rate, 5 even or unaliving events in our community, and that's something we definitely need to be very cognizant about. And I know we are all doing everything to the best of our resource ability, and we can always do more. What I learned recently from an event where there was 3 overdose deaths, that potentially these individuals, even as loud as we can be, that they don't watch the news, they don't get access to information. So taking different harm reduction strategies are extremely important to be able to reach these individuals. These individuals did have some sort of support, as mentioned, but as we know, there can always more be done. And with that being said, I know we'll be sharing at the upcoming Drug and Alcohol Committee meeting information about a harm reduction strategy where we're going to go out to the street corners as organizations, and when people are going home from work on a Friday for Friday night, Saturday fun, that they see us in every district on March 1st with signs at 9 strategic locations. Health, we have to do the same thing for mental health, because ultimately, as we do know, substance use disorder is linked back to mental health disorders as well. So with that, I encourage us to brainstorm on harm reduction strategies that we can employ that are outside the box, that are not just, of course, us talking about it, putting out a news release, having an event, because that stuff, we're doing a great job. Is those non-conventional knock and talks too. I mean, going through neighborhoods, of course not stigmatizing neighborhoods either. We wouldn't want any media to know about this, but it's also something that we'll be doing for the overdose situation. We actually start this Friday, but we're not sharing about it because we don't want to stigmatize those neighborhoods as well. Just Laredo Public Health, we're partnering with fire, police, Roots part of the street guard. That's what we're titling this operation, for that one-time event to boost what's going on in the community. Because sometimes that's the only that they're getting in that day or that week or even that month, for all we know.
So on that note, Doctor, I have great news, I think. At least it's for us moving a step forward to our vision. I know everybody knows about our mental health unit, who are police officers, highly trained to deal with these very special situations, having to deal with overdoses, mental health, suicides. And they're a wealth of information, especially the way they're designed to react to these cases. We've experienced great success. As much as we hear about this unfortunate event, it could have been a lot worse. We have great stories of success to share. People know that. After effects of this program is that the fire department is also launching a very similar program. In fact, we're in conversations to link up together, and we're going to be doing not only hopefully responding eventually 24 hours to these cases outside of life. We want to be able to eventually come to the point that these resources or these experts in the field are answering to these calls for service. Moving towards that direction, I invite any of your programs to join us. Right now is in this very stage of inception, even though our programs already have been up and running for 2.5 years, linking up with the fire department. But it doesn't need to be very formalized. Any of your programs are more than welcome to join in and eventually do a combined response where you have fire, police, and social workers, not only responding to the cases as they're happening, but also in the downtime doing case management, visiting families that have called see how they're doing, especially in situations where there's an actual life lost. I know sometimes we try to do, especially now with the programs that a lot of the campaigns that we launch in educational, but we know that when the moment's happening, they're in a different state of mind. We can't capture them. A lot of the information that's related to them is lost. So catching them back in a better time, where we can share this information and hopefully guide them, help them navigate through these and eventually be in a better place.
Thank you for your comments and thanks for your presentation. Before we go further, I just want to ask Angie. Angie, would you mind doing roll call so that we can confirm to see if we have a quorum, please?
Yes. Dr. Julie Basan,
Present.
Maxine Present. Sergio Chavez, Ana Sainz, Marisela Jacqueline, Earl Medina,
Present.
Thank you, Angie. Based on the roll call, we do have a quorum, so we can take action on items that we talk about tonight. Thank you for coming, everyone. And the report that we just received, of course, is alarming. There's no words to express how I'm feeling right now. And this is why this committee is super important. He wasn't here when we talked about it, that we are meeting the last Wednesday of every month at 5:30 here at the Health Department. So put that on your calendar so that you can touches all of us. I mean, if we live in this community, we are touched by these tragedies. Unfortunately, I just feel like there's no words for me to say to express. And what Dr. Chamberlain said is that, you know, we need to think outside the box. We need to do more. Yes, we're doing good. We're doing about any of you. People need us. People need to hear that there are resources, that they need to speak up, that they need to just reach out for help. So now what are your thoughts? What do you think that we haven't done that we need to look at? In summary, the most recent thing that we have accomplished is we have given, thanks to the staff at the City of Laredo Health Department, for when they respond to these cases, and on that card they had numbers and information as to where the people could reach out for help. I know we talked about that card is very, very useful. It's small enough to where the police department, whoever responds to that call, can just hand them to the individual or leave it on the door or on the table very discreetly. And I want to hear from you guys. I don't know.
Those cards were distributed to our mental health unit, and they have been, the individuals that they've interacted with, they have been very receptive to it. Just the simple fact of it being brought up to modern day technologies just it speaks volumes from them, especially. The way that something so small can open up so many windows of resources, even after we leave. So there has been a good response to it overall.
Thank you so much for sharing that. The entire community came together to create awareness about the 98 and other resources in the community, and we kicked off with a big momentum. Some of you were part of that movement. And as you recall, the Day and 98 Awareness Day. And we all did our best to get the word out, but it's still not enough. We need to do more. So those are just some of the things that we have done, that we have tried, that we think have worked. At least we have reached out parts of the community that had never heard of the 98. To this day, I still run into some people and they say, what is that? So we can't stop talking about it. But maybe, I don't know, I can't speak for them, but maybe sometimes you're not the experience was horrible. Who says that's not happening, even though they're getting services, maybe they're not happy? Let's give them an option, or let's remind them. So I'm gonna open the floor. I don't want the numbers to go up any higher than they are right now. And of course, that's just me. So Gabriel, what do you think we can be doing? Session, I don't know. Look at what other cities are doing. What do you think?
Thank you, Dr. Lozano. Thank you for the report. We really appreciate it, and for the efforts that Dr. Chamberlain has done, and the city has helped us out. And I know, looking at the numbers, it's certainly staggering such an early time of the year. And something that popped to mind was the youth, right? Seeing 15-year-olds, which is awful, right, at any age. And something that I thought maybe to take it a step further, even working closely with the districts, whether it's LISD, UISD. I personally haven't been in a school in a long time, so I don't know how their campaigns are. I don't know how their movements are, if they have this kind of maybe that's a startup, especially for those youth that might be prone to substance use and obviously other mental.
School districts are working together in anything to do to stop these type of tragedies or drug abuse or overdose, anything that destroys the lives of our youth. I've gone by several schools and I have seen where they're posting the 988 on their t-shirts. So some of it is being done, but we need to do more. Revisit that initiative and invite them and tell them, don't forget that we still can save lives by telling people that there's help. So can I just summarize what you mentioned and maybe call it, re-emphasize?
Sure, yes.
The awareness of the resources, right?
Yes.
Thank you so much.
School teacher, I teach mediation, and I don't think that that's a class that everyone has, but like in my class, that this is exactly like what we were watching. We had a movie guide for the Freedom Riders. I don't know if y'all have seen it. And there's a part where like they're telling their stories, you know, and I told students, you know, like, you just gotta remember, you know, it's not your fault. And then like one of them just broke down and started crying, you know what I mean? And sometimes that's all they can. Time to be telling them that anymore, you know? And if there's not gonna be any classes in the schools, I don't think you're gonna reach as many kids as you need to reach to stop this. Cause it's a cycle that we can't break, and these kids have no outlet. Like, it's testing all day, every day, and no one wants to talk about it. And that's the stigma that we need to break. Like, cause we're losing these kids. And if you really want to make a difference and stop these kids from doing this stuff, that you need to teach them, you need to talk to them, you need to reach them somehow. But right now, most teachers' hands are tied.
Your points are very well taken, and more so because you are there every single day with the students and everyone that comes into your classroom. So if I may just summarize what you mentioned, break the stigma somehow, talk to the students, make them feel like somebody cares, somebody's there for them, but talk to them because they have no outlet. And it's very concerning because, like you said, everybody's worried about the testing. Very, very scary. Thank you, Maxine. Carl, what about you?
I just feel that we need to network out there and give out presentations, show up to fairs and everything, and represent what we stand for. even though our law enforcement and everything are out there spreading the word and everything, but we as an organization need to be out there giving these presentations in the schools, in the colleges, anywhere that we could network, so they could know that this organization and community exists. So they could be aware that, not that we're only just promoting 988, we're promoting the system, that there is somebody out there that wants to help them out, wants to hear them out. Like how the chief said, so how many calls does 988 get? We don't know. Network is busy. We need to find another resource that they could communicate with somebody that is out there. For example, my organization involves a lot of situations, not just with the LGBT community, but also with the overdose awareness. And we have a life experience life coach that's 24 hours that is there to take their call and hear them out and understand what they could help with them. So we as a community have to get out there and network, socialize, what this community is about. Not have our doors closed. I know we all have busy schedules, but we could at least take one time out of our chance to be out there and let our community know, especially our educators know, that they have these sort of resources out there.
Thank you so much, Earl. And you know, going back to when we first started meeting as a community, representatives from different agencies, the school districts present, were very much aware of the fact that students needed to know what was happening, what was made available for them, and they helped us carry that message out. It doesn't mean that we should not continue to do it. Yes, we will. But I just wanted to say that we kind of made a little bit of a dent in that area. But if I'm not mistaken, the majority of the suicides are in the young adults, correct?
Well, no, they're widespread. They're mainly males. I believe it's middle-aged adults is the ones where we see that spike, but it's a range between late teens to 50s. And I think last year locally, I think it was towards the older group of adult males.
So,
I'm sorry to interrupt, but that 15-year-old female is an anomaly in the sense of statistics, because we rarely see females, especially young individuals. One piece of information that was schools, one of the factors that to this particular case was that the young girl was being bullied at school and had relayed that to the mother. In fact, she had dropped out, just stopped going to school because of that.
So that's the reality of the tragedy that we are facing. To all the age groups in different sections of our city, throughout the county. And it's about working together, like you said, Earl, whatever we decide to all commit to it. And then not just us, but we can, once we decide as a committee what we will be doing, bring volunteers into our network and our circle and invite them to help us carry that message, the initiative, make presentations with us, because the four of us here will not be able to cover all the community. So I just want to make it very clear. I know sometimes we know people that are very passionate about if we want to embark on or how we want to start tackling this. I want us to be able to invite those people to work with us as volunteers, because I think that we're going to need all the help that we can get. What do you think? Dr. Chamberlain, thoughts?
I think, I mean, that's definitely where we need to be at. Trying to activate more lay counselors within our community. I think that would be a great opportunity for us to be able to expand on the number of individuals in households and social circles, in workspaces that have this type of training, encourage organizations to adopt it. We'll research it more and put out information as the Laredo Public Health Department to inspire organizations to develop this type of expertise within their structures, and then ultimately that infiltrates the society that we have here in Laredo outside of their organizations. So as we all know that there's a significant shortage in this type of support, especially at the licensed level. If we can start to build bridges and pathways towards any type of support for situations of crisis, and then ultimately for mental health disorders. Of course, there can't be diagnoses involved, but just having that lay counselor training, which there's a lay counselor institute, would be a significant benefit and another step in the right direction for our community to employ this practice as a system in Laredo.
I think that's an excellent idea and comment, and I wish I had a magic wand where I could just wave it and all this would come to fruition. Everything takes money, planning, and all of the above that we're all very familiar with. As you were talking, Dr. Chamberlain, I was thinking about what can each employer do in their institution, in their company. Think about all the forwarding agencies that we have. Think about all these restaurants. Think about what is our industry, the education, the forwarding agencies. I envision that if we can't do anything other than talk to those employers and encourage them to have what some entities already have in our community, a safe zone. It could be an area in their agency, their work. Have some peace. They would find these things on there, or a poster, or imagine if we could do that. Do you think that that would be a start?
Yes. I think honestly, as we see the numbers, I mean, it's all males ranging from 21 to 67. For those that don't know me, Erica Lopez with Laredo Public Health. Since October to now, our health educator has gone out to has done over 100 outreach. And I've always focused on that population that gets underserved and is very stigmatized, which is males. So we go out to these places where males sometimes are. We are, during the day, we're at Casa Raul. We're at Pronto Meat Market, we're at Dr. Ike. We're at Academy, giving information daily on not just 90 days in suicide prevention, but also mental health awareness and the resources out in the community. I want to say back in September, I did do an Ask About Suicide training at a local barber school, which hopefully that'll become part of the curriculum where I can go every semester to do that. I went back not that long ago. Now actually our still has that 90-day magnet up on their station. So I think it's not asking them to come to us, but us going out there and putting 90-day information at, let's be realistic, tattoo shops, bars. Them to come to us. So I think, we do our part where we can. We're at the courthouse, we're at the City Hall Annex, in Metro, we're at Dollar Trees, DD's, anywhere that they'll have us. If you guys and we try to provide as much information, and sometimes even just somebody asked, like they're like, oh, they just asked, they had never heard about the 98 and they took a sticker. They took a magnet, or they said, you know what, my brother was just diagnosed with bipolar disorder, so they take family members. So I think it's not just getting that awareness on suicide, but getting that awareness on mental health in general and how we can be of more support. So far, I mean, it has been very helpful. We do get a ton of different calls to our office, even if they don't qualify for our services, since we are court ordered and a little bit more. Has done an amazing job. I mean, I pretty much talk to one member weekly, where they call us and let us know.
Thank you so much for your service, and I know that y'all are doing a fabulous job, and I commend you for doing that, and definitely we need to do more of what you're doing. And we would love to be part of your outreach efforts. I do agree with you that we need to go out to where the people are, and our expectations are that we're gonna go out there. But like you said, advocate for mental health and the fact that there is help. I think this is a great idea again. If we just presentations where all these members come together once a month and talk to them, give them the idea, let them know this is how you can start. Invite them to help save their employees. And if we do that with all these groups, they all gather once a month or twice a month. We can do presentations. Where all of us work, some of us have very strict schedules. So as committee members, I want to hear your thoughts on that. And I want us to really think about it.
Ms. Lozano?
That's a very good question, Dr. Chamberlain.
Unfortunately not. There's typically no financial support for the city of Laredo committees.
Well, the reason I ask is I have kind of an unconventional idea. Maybe doing some coasters with a catchy phrase, QRQ code. So for people in the bar, and it's not that expensive, but maybe we can get some buy-in from our very closely with them to develop that business and the Eat Street movement. We're soon to have a meeting, I believe probably Friday. I think it's Friday. If you don't mind.
Carry the message.
Produce them, but distribute them at the location.
That would be great. What do you need from us?
Make sure the committee's okay with it.
Okay, so that's something that we can decide here as a committee and vote if you want to.
We could do that as well, or we could also place a sticker out their business if they allow it.
There's tons of magnets, guys. I brought some. You're more than welcome to take
Why don't we
some.
do both? I mean, but let's take advantage of this opportunity, because like Dr. Chamberlain says, there's no funds. I can probably come up with some money. How many stickers or bumper stickers or stickers for the facility can we print? I don't know, but for now.
There's like maybe 12 bars downtown. Then we have the ones in Central, so you're looking at 26. Sorry, I work with the bars.
Oh, you do? Oh,
Yes.
Oh, so you will be out here. So. Friday, can you, or whenever, or do you need me to go with you? Ask for permission for us to put that sticker or poster, whatever it is, in addition to the posters?
If you want to help us with the coasters, there's one thing that we used to do, we kind of stopped doing it during COVID, and we haven't gone back to doing it. What we would do to raise awareness and keeping your vehicle safe, like your cars,
Yes.
the message of hiding your belongings. We had these placards, and what we ended up doing, and talking to the bar owners and thinking of the best way to put it, especially because we had a limited amount. I don't want to get too graphic here, but urinals for the guys. Sorry. So is there relieving themselves, they're just staring at the wall, they're reading. The message, concise, to the point, it helps.
Yes, yes. Okay. Now, the question is this, I guess first we would need to vote that we agree to get coasters, made possible. I need to hear if you agree on that, and I would like to call for a vote. Earl?
I agree.
Maxine?
I agree.
Accept that recommendation and assist in making it go forward.
I'll first thing on.
Okay, thank you, Earl. Second?
I second that.
Second by Gabriel. We have a motion that has been moved and seconded. All those in favor say aye.
Aye.
Opposed, same sign. Okay, no opposition. The motion carries unanimously. The status after you meet with them?
Of course.
Now, the question for the committee is this: what message do we want? Because it's gotta be eye-catching, it's gotta be,
My suggestion is, of course, the design of it, and you want to just a catchy phrase that captures not just people that are interested in the subject matter, but everyone. A phrase in the QR code that would catch the messages and the resources, not too wordy, straight to the point, and something that they can take with them. It'll be on their phone if they want to share that link or take that message with them. It's already there, yes.
what do we use then? We have it there, we have it in English and Spanish. If you help us here, you're not alone, 90 days, and then the QR code. English and Spanish.
An Alcoholic Anonymous deal, and they might just dismiss it altogether. I want something that doesn't, it's not about help, it's just interested in very useful information that you might not know about, click here. Or
Like something like,
very
it'll spark their interest.
something very general that just hooks people. Once they see the message, if it's useful, they'll keep it. If they want to dismiss it, so
Or any other way they want it during at a bar, but once they scan that, it is the S word, which is suicide.
and maybe this is
I
more
thought
for
we
the
said we didn't
community.
want to focus on suicide. This is mental health, right?
That's
Well, it will have all the S and just S word and then the.
And this is where I would leave it up to this committee to decide what would want, that those are.
A little bit of time to think about this, because I like to see what other cities or places are doing, so I can do research on the computer. Gabriel, Earl, Maxine, what do you think? A message, a simple message.
I like that one,
And
because
yes.
like, they're gonna be curious,
Mhm.
like.
What's this about?
Like, what is that?
And then it's all the.
Or you can do
I
like,
that
if it's a
one.
coaster and it's circled, do like a big S word, and then put the QR code within there, so they'll scan it and they'll figure out what the S word is.
S word is a movement.
Yes, that's why we did the project using like Puerto Rico.
S word is a movement. And you can also put, that's that one, but you also want to do bilingual.
The what I'm saying?
You could do something bilingual,
So-
and it says like, do importance.
So that's the whole idea about the coaster.
Flip it.
Uh-huh.
One
The other
side will
side.
be English, the other one Spanish, and they'll be distributed randomly, so.
Because I remember when we did that movement years ago, it was very productive.
Like that phrase that she said, "Tu importas" is you matter.
You matter.
So the S word and then you matter,
Yeah.
and then they link it.
Um, Maxine?
You could put you.
Yeah.
Gabriel?
I love it. I think it's a fantastic idea, very subtle, straight to the point. Very easy to snap a picture of it and find all the resources available.
And the QR code? Do you have a graphic designer that can help us with that?
We can go ahead and, with public health, we can go ahead and do it.
Okay.
Okay, so can you work on something for us?
Would the committee be okay if whoever is sponsoring this stamps their name somewhere on that coaster on the side around it?
We would probably have to get with legal on that one. I'll do that for us. So.
And this is on anything that they are financing.
Mhm.
So in a way, it's their product, and they're just they're pretty much
Is there
distributing harness.
is a donation to the city of Laredo, and that would be a legal form. I don't know if you've seen it.
Yes.
So,
Okay.
yeah, I mean, the possibility
So
there.
we'll do it as a donation, so we have complete control.
Mhm.
Okay, so then it's decided. Thank you for being creative. As soon as we get something out. Now, let's just go back for a moment, because Gabriel said that we need to, re-energize. If we do that in our network and how we were doing it before, let's continue doing it. What do y'all think? That doesn't require fund. We can invite the members of the coalition to, we can call a meeting, I'll call a meeting with them. It's a coalition meeting of the community members, letting them know that we need to get back on track. And, that they're good ideas. If it doesn't require brainstorming and decisions. Open discussion, does anybody want to share anything, or?
If I may again.
Yes.
Sorry. I also want to let everybody know that if there is an opportunity for funding that your organization is not we're always more than willing to take a look at it. We have a very experienced team now with partners now here with us at Laredo Public Health.
Excellent.
So we've built a great infrastructure with subject matter expertise in the process. To us, if you find out about something, but your organization can't do it or you don't have the bandwidth, we're all about it. Anything that we can do to scale programs, and this is definitely something that needs more attention, don't hesitate to take it over to us here.
Even with collaborations.
Thank you so much for
Collaborations,
that.
absolutely.
Anybody else? Yes, ma'am?
Region Behavioral Health Center. And I know that there's always a lot of push at the schools for an example like McGruff, like Say No to Drugs. There's a Red Ribbon Week that's campaign that also incorporates bullying and whatnot, but talking about self-care incorporates mental health issues that affect many people, not even young people. And putting in the plug for the 988.
Excellent idea.
Maybe even having those 988 information at many places where different people attend, as the chief mentioned that about the restrooms. I was thinking also probably educating like the individuals that belong to the Chamber of Commerce, because they all have different entities.
We newsletter, the 98 messages there, so, but it doesn't mean we can't do more, we can do more definitely.
Monica Martinez, I believe she's the head now of Commerce, and she's really active and wanting to.
Like the Boys and Girls Club. I know money is a factor, but like at bus stops,
The waiting booths.
yes.
There's a lot of opportunities, and I want to invite all of you to please type it on a sheet of paper or email us or email Angie or Dr. Chamberlain, because then what we can do is prioritize based on the funding that we have available or resources, and maybe we can take it one at a time. All ideas are great, all ideas are welcome, but we have to be realistic with what we of you also that have any ideas. The discussion does not stop here, because we go home and we think about it some more, or maybe we talk to our circle of friends, what do you think we should do to prevent this? Maybe they have something in their mind that we haven't thought about. So just keep that in mind. I want y'all to continue thinking about it and sharing, and we can put it on there. And other than that, it's 6:32, so I will go ahead and invite someone to make a motion that we adjourn this meeting. Gabriel? Opposed, same sign. Motion carries. I want to thank all of you for making the time to be here this hour that you spent with us. It's really going to impact the future of this community, so thank you so much.